It is my great pleasure to introduce our first speaker for today. Dr. Constanze Lämmer graduated in medicine from the Leipzig University and received her doctoral degree in 1992 with an emphasis on endocrinology. After 8 years in internal medicine, she started her qualification as a pediatrician and became senior physician at the St. Bernward Hospital, Hildesheim in 2005. She's qualified in pediatric endocrinology, diabetology, nutrition, somnology, and epileptology. She established the Hildesheim program for treating people with PWS and sees frequently more than 300 patients with PWS. In 2015, this program was awarded the ACHSE Central Prize for Rare Chronic Disease Treatment. Frequently, Constanze undertakes instructional workshops for families of children with PWS. She's also scientific advisor to the PWS Association in Germany and medical advisor to IPWSO. And Constanze has presented her work at very many conferences around the world. Over to you, Constanze.
I'm happy to be able to present today something about nutrition and Prader-Willi syndrome. So the title is Diet and Exercise and the Prevention of Obesity. And I'm going to start with something about the diet, and the exercise will be presented by Georgina afterwards. So in my presentation, I will focus on the energy intake, which has to be reduced in Prader-Willi syndrome, the special metabolic situation. We will mention keystones of the healthy, balanced diet, and learn what's necessary for the everyday nutrition and for the Sunday nutrition. We will mention some psychological aspects of nutritional management and how to prevent obesity. So the energy intake in Prader-Willi individuals have to be reduced due to the muscular hypotonia and the less muscle mass. Individuals with Prader-Willi syndromes are able to gain fat readily, they have a greater fat storage. On the other hand side, they have a reduced active energy expenditure due to reduced movements and lack of exercise. So altogether, they need 60 to 80% of the daily recommended energy intake of peers. Often it's not easy to realize this in daily nutrition. If we look to the metabolic side, we find often a disturbance in the glucose metabolism, a problem with insulin production. Insulin is a hormone which is necessary to bring glucose in the muscle cells, but if we have too much glucose, it helps to build up fat and to storage fat in the body. Individuals with Prader-Willi syndrome has a reduced thermogenetic effect and disturbance in oxidative energy production. And of course, the less levels of growth hormone also have an impact on the metabolic situation. So the recommendations for the energy intake for individuals with Prader-Willi syndrome are start with 2/3 of the caloric intake of healthy peers. That means you have to take the normal weight of healthy peers in account and calculate, for example, for the age of 1 to 4 years, 60 kilocalories per kilogram. But think about not of the body weight of the person, you take the body weight of a peer with normal weight. So these instructions are a bit complicated to realize, and that's why often it's easier to calculate this for the families or for the group home and present the total recommended calories per day. And this, for example, comes up to 800 calories, for example, for a boy aged 1 to 3 years. A girl needs a bit less calories per day. And you see a boy between 4 and 6 years of age need 950 kilocalories and so on. We have an overview for the different ages in this table. So it's easier for the families. That's an idea to start with calories per day, but of course you have to wait, wait, and wait. The best is start with weight every day. Later, maybe if you have a stable situation, you can do it twice a week or once a week. And then if you not can realize the aim, you have to reduce or to adapt the calories by 10%. If you have someone which is older than 15 or an adult with Prader-Willi syndrome, you also can calculate the caloric intake on the body height. This means the body height of the person, the Prader-Willi person. So usually you need 8 to 9 calories per centimeter body height to maintain weight, 7 calories per centimeter body height to reduce weight, and to gain weight more than 10. If you can't realize weight reduction with 7 kilocalories per centimeter body height, please do not think about lowering the calories. Look for holes in the fence. That means there have to be any uncalculated calories in the environment, and then we have to stop at first these ones because before we lower the calories, because too less calories means losing body, not only body weight, losing muscle mass. If you know how many calories the individual should be given, you have to think about how to realize these calories. And a balanced diet, which is helpful for individuals with Prader-Willi syndrome, comes up with 45 to 50% of carbohydrates, 25 to 20% of proteins. That it is a bit more than the usual advice, because it helps to feel better after meal, to feel more satiate, and only come up to 30% of fat. This diet should be very restrictive in the use of sugar and high glycemic index because of the insulin response. Unsaturated fatty acids should be preferred, and please offer a lot of energy-free drinks. Usually, vitamins and minerals are enough in this kind of diet. Only vitamin D has to be added. The nutritional pyramid is helpful to explain such a balanced diet to families, caregivers, and the environment. So you see on the bottom the caloric-free drinks, and the next level, the veggies. We need 3 portions of veggies. And if you have an orientation for the portion size, you take the hands of the individual with Prader-Willi syndrome, and in this case, 1 to 2 hands of veggies are fine per portion. In the next level, you see the complex carbohydrates, which come as bread, pasta, grain, and potatoes. You can have 4 serves a day. 1 serve can be the bread, the pasta, the potatoes in the maximum size of 2 hands. For bread, the size of the hand will be helpful. Please stay with 2 portions or 2 serves of fruits. More fruits have too much sugar and also give problems with the insulin production. And in the next level, we have for a good calcium supplementation, 3 portions or serves of low milk products on the one hand side, and 1 serve of meat, sausage, or fish per day. Use unsaturated fatty acids. These are necessary for a healthy nutrition. Which is not necessary, or the sugar on the top of the pyramid, and it's only for nutritional Sundays. These can you give an overview about the energy content of the different food groups, and it's also helpful to explain a family why it's not the same if we have 1 cookie with 1 chocolate cookie more, or have 1 carrot more, for example. 500 grams of cookies, chocolate cookies comes up with 500 calories, and this is enough for an adolescent energy for walking about 10 kilometers or riding a bike about for 20 kilometers. So there's a lot of energy. On the other side, if you have 100-gram vegetables more, it comes with 30 kilocalories. It's easier to manage this. Helpful is also the so-called lunch plate rule. That means if you have a plate and fill it up with half of the plate with veggies, you have only a quarter for potatoes or pasta or rice, and a second quarter for meat, and the meat should have the size of the hand plate. So you can give caretakers and other family members an easy orientation how a healthy lunch plate should look like. If we have the nutrition the individuals with Prader-Willi syndrome needed, and we have an idea about the healthy diet, we share this energy intake in 3 parts over 5 meals. That means a third of the energy is given for breakfast and morning snack, a third for lunch, and a third for afternoon snack, dinner, and sometimes children get a small bedroom. Here you have an overview about the rules for healthy food. That means we should offer varied but not too much food. It's necessary to cook fresh and avoid served meals because they often come with a lot of carbohydrates and are not very healthy. We can cook tasty with a lot of vitamins using spices and herbs, but not so much salt. We should have enough, but not too much grain and potatoes. Please think about the orientation for bread on the hand size. We can use plenty of vegetables. They are always helpful to reduce the caloric density of meals and to make meals a little bigger. We should avoid fat and high caloric food and also the cold fast food. It's necessary to drink enough and take time when eating. Helpful are also rules which tell the people easily what happens during a regular meal. And one rule is my plate, my meal. That means families not have bowls in the middle on the table. They serve a plate with the right size in the right size for everybody, and the child is learning if this plate is empty, the meal is finished for me. It's very helpful, and sometimes you can place a vegetable bowl in the middle to have a small second or third spoon, but the high energy components are only on the plate. All members of the family, all caregivers should be instructed with the individual food plan. This gives security for the child and for the environment. It's helpful for children, but also for adolescents, to cut bread or meat in pieces so it looks more. You can always add vegetables also to make a bigger size of the plate and it looks better. Drinking 1 glass of water before starting a meal helps to feel satiate. You should always be aware of uncontrolled access to food, and that's why I advise to wait, because otherwise you can't find the holes in the fence. If you see the child is more interested in food seeking, please lock the kitchen. It's necessary and very helpful for the child and for the family's life. Individuals with Prader-Willi syndrome can involve in decisions if possible. But you always have to prepare for changes in behavior if you change something in the nutrition. The nutrition is always the most sensitive point. If children are old enough, you can differ between everyday nutrition and Sunday nutrition. Often it's in the age when they are visiting nursery school, because then they understand there are some weekdays or working days and there's weekend, and maybe weekend also means something special in the case of nutrition. Keep in mind that children with Prader-Willi syndromes like their daily routines. They're like, that's always like they expect this. So define clearly rules for eating. What are the places to eat? What is the right time to eat? What is to be eaten? It makes daily life more easy. And please avoid eating in front of the TV, also for the whole family. Be aware that changes in nutrition can irritate the child and trigger behavioral problems. Nutrition is always the most sensitive point for the child. Exceptions have to be explained in advance, so they are easier to accept it. Always the nutritional control has to be in the hands of the parents and the caregivers. You should control the weight on a regular basis. You can use a growth chart, for example. Please, if you change something in the environment, maybe it's changing something, the child moves from kindergarten to school, or there's a change in the caregivers, during the caregivers, use the weight to control if everything happened in the way you will expect this. Nutrition and exercise can prevent loss of muscle mass under a low-caloric diet. The exercise are very important, and that's why Georgina is continuing with her presentation.